You are listening to a recording from the 2021 PM&R Scholars Virtual Residency Fair. We would like to take a moment to thank the residency programs who have taken the time to present at our fair this year. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap, the best resource for your Physiatry clinical preparation, audition rotations, board preparation, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and even oral board cases. Head to pmnrrecap.com to learn more.
All right, so hopefully everybody can see and hear me. So I'm David Lee. I'm one of the administrative chief residents at JFK Johnson Rehab Institute in Edison, New Jersey. And first, I want to take the time to thank PM&R Scholars for organizing this virtual fair event and giving us the opportunity to talk about our program and share why we think it's so special. I'm joined by our other two chief residents who will be introduced later on in the presentation. The first 10 minutes of our presentation will be a short video about our program narrated by our very own Dr. Cucurullo, who is our rehab chair, the chair of the department, as well as our program director. And Dr. Begay, our associate program director, is also on the video as well. After the video, we'll introduce the other chief residents who will talk briefly about their own personal experiences at JRI, as well as talk about some of their favorite aspects of the program. And then we'll open up the floor to any questions that you may have. So without further ado, I'm going to share my screen and then we'll see the introductory video.
Welcome. My name is Dr. Sarah Cucurullo. I'm the chairman, residency program director, and the medical director for the JFK Johnson Rehabilitation Institute in Edison, New Jersey. We're very excited that you're here today, and I'd like to go through some of the key components of our program. The JFK Johnson Rehabilitation Institute is located in Edison, New Jersey. We're the Department of Physical Medicine and Rehabilitation for both Rutgers Robert Wood Johnson Medical School and the Hackensack Meridian School of Medicine. We are attached to an acute care facility called JFK Medical Center. It is a 475-bed acute care hospital. This is a tremendous benefit to our residents in that we have consultants and medical support for our residents attached right to our rehab institute. Many of the consultants have privileges at both Rutgers Robert Wood Johnson Medical School and Robert Wood Johnson University Hospital, in addition to JFK Medical Center. So our patients that come from these facilities have a great continuum of care. We have a 24-hour code team, and we have many other benefits of being attached to an acute care hospital. I'd like to talk to you about our academic curriculum and then our clinical curriculum. We have a very structured academic curriculum that covers the 12 main topics in the field of PM&R, with which we follow the self-assessment curriculum. Those 12 topics are covered month by month. So each month we cover a separate topic during our protected block time from 8 a.m. to 1 p.m. We have visiting professors, journal clubs, grand rounds for each didactic month that focuses on one particular topic. My topic happens to be stroke, which occurs in September. The curriculum over the course of 1 year covers all the 12 topics of PM&R. So we have the benefit of having our curriculum repeat 3 times during the duration of the residency program. And as I said before, the entire month is committed to each of these 12 major topics, where guest speakers and workshops are built directly into that academic curriculum and our protected block time. Part of our academic curriculum is a senior board review course. It runs from January to June during their senior year. It follows the SAE curriculum that is an extension of our academic curriculum that occurs the 3 years during their training here. And we have published a book, the PM&R board review book, that contains the notes from this board review course. It is covered over that 6-month period of time, and by the end of their training, the residents are ready to take the mock exam and the actual board exam that occurs in August of their post-graduation of their senior year. We do mock exams for part 1, but we also do mock exams for part 2, in which we prep the residents for their oral exams. Other aspects of our academic curriculum include a cadaver course and outside courses, which is a benefit because we are in the tri-state area. So we benefit from some of the strengths of some of the other programs that occur in this particular area of the country. So being in the tri-state area and including Pennsylvania, we benefit from those programs. Within our program, we have workshops that occur, which include spasticity, injection workshops, trach workshops, and we have monthly ultrasound workshops where the residents get 2-hour workshops and work with the sports medicine trained physiatrist boarded in sports medicine, and he trains our residents in ultrasound, which is extended then into our clinical realm. We have research opportunities and a research requirement. Our clinical curriculum, probably one of the most beneficial aspects of our clinical curriculum, is that we have a 1-to-1 attending teaching ratio with individual teaching assessment of each resident. The rotation schedule is formatted to allow the residents to focus on the specific areas of PM&R. Each block is broken into a 3-month curriculum. So we focus during your PGY2 year on brain injury, cardiopulmonary, spinal cord, and stroke. As you can see, there's multiple different areas in the PGY3 area as well, and the PGY4 area as well. Our clinical curriculum, part of the assessment is our clinical competency program that assesses the competency of each resident at the end of each rotation. Each resident during each one of their rotations will get a full clinical competency assessment that will make sure that they know how to do all appropriate procedures and all exams for each one of the individual areas that we cover within the clinical realm. There's ample hands-on experience for all of the procedures that you see listed here. And we not only meet the ACGME requirements for these hands-on experiences, which include EMGs, ultrasound, Botox injection, joint injections, in addition to many others, but they not only meet that requirement, but they exceed it. We have another unique aspect about our program is our 3-month elective. 1 month is allowed out of house, which allows residents interested in fellowships to showcase at other programs. In addition, we have 2 months that are required in-house that allows for research and specialization. We have an optional sports program for anyone interested in sports. They can be involved in high school football games, physicals, and wrestling weight certification. We also have fellowships here that are offered at JFK Johnson. One is an ACGME pain management fellowship, and the other is a brain injury medicine fellowship. Our graduates, about 50% go into private practice and 50% go into fellowships. The recent fellowships obtained here include brain injury medicine at Mayo and Tears program, pediatrics, pain, and sports medicine, all of which are very prestigious fellowships that our residents have matched into. The professional careers that we have for our residents include, as I said, both clinical, and they either do fellowships or they can go into a professional career directly. That includes go into academics, which they can go to any of the programs listed here. And our graduates have also gone into private practice setting. I'd like to thank you for being here today with us to learn about our program. If you have any questions, reach out to our program coordinator, Bev Bolger. Her contact information is there. I'd like to also encourage any of you that may have questions for me to ask, please contact Bev, and I'd be happy to answer any of the questions you have about our program. I wish you all the best in going into the field of PM&R, as it's a wonderful field, and we look forward to seeing you during the interview season. Thank you.
Hi, everyone. My name is Leslie Begay. I am the Assistant Residency Program Director here at JFK Johnson Rehabilitation Institute. What you may not know about me is that I was actually a resident and chief resident here in the Department of PM&R at JFK Johnson Rehabilitation Institute. After graduating, I was hired as an attending faculty member in the Department of PM&R. My clinical duties most recently have been include developing and being the medical director of our cancer rehabilitation program, which I'm really excited about. In addition, I get to work with the residents and in resident education as the assistant residency program director. I also get to work with medical students as a clinical assistant professor, both for the 2 medical schools that we work with, Rutgers Robert Wood Johnson Medical School and Hackensack Meridian School of Medicine. Since I was a resident here at JFK Johnson Rehab, the department is more than doubled in size, both with attending faculty and staff. This has led to the creation of many new programs because of the diverse interests and specialties that our faculty work in. Some of the things I wanted to talk about are our aftercare and stroke recovery program and our cancer rehabilitation program, which follow patients with ongoing rehab needs in the outpatient arena. We also have a very robust concussion clinic here, and our Center for Sports and Spine Medicine provides ample opportunities in musculoskeletal and pain medicine for our residents. Something else I wanted to highlight was that many of our graduates actually stay on and become faculty here at JFK Johnson Rehab. Some start right after residency, like myself, and others go on to do fellowships in other areas and then return and bring their new skills with them. I think this really speaks not only to our residency program, but also to our Department of PM&R here at JFK. Some of the things that I really enjoy about the culture of our department include the teamwork, collaboration, communication, and patient-centered nature. Our attendings and residents work together many times on presentations, research projects, publications, and book chapters. Every day, our attendings and residents also work together with our therapy teams, nurses, and other staff to provide the best care possible for our rehab patients. I hope this gave you a little bit of information and knowledge about why I have really enjoyed training at and staying at JFK Johnson Rehabilitation Institute. I hope to meet all of you again soon.
Okay, and so thank you for watching our video. So before we go to questions, the Chiefs wanted to talk briefly about ourselves and some of our favorite aspects about the program, which I think will give you all a better understanding of our daily lives at JRI. So again, I'm David Lee. I'm one of the administrative chief residents at JFK Johnson Rehab. I'm originally from Kansas City, and I went to New York Medical College for med school. One of my favorite things about our program is the way our call schedule is structured. We have home call, which is great because you're essentially working from home, which is always a plus. Excuse me. Our weekday call goes from 5 p.m. that day until 8 a.m. the next morning. And our program's call responsibilities are front loaded. So as you progress in residency, you'll have less and less call, which is the way that most residency programs have their call structured. So when you're in your first year at our program, you have 7 total weekend calls. So weekend calls from 5 p.m. Friday night until 8 a.m. Monday morning. So with 7 weekend calls as a PGY2, that means you have 45 other weekends free, meaning you'll have those Saturdays and Sundays off. And that's super nice, just having both Saturday and Sunday off, because that really gives you the time to pursue your own interests, hobbies, and spend time with your friends and family and pursue other things outside of medicine. And by the time you're a PGY4, you only have 1 weekend call. And so, and you're essentially done with any weekend or weekday call by October of your last year. So that's one of my favorite aspects of the program. Next, I'd like to call up Elisa Chu to the mic.
Hi, everyone. Hopefully you guys can hear me. Thanks for joining in to learn more about our program here at JFK. My name is Elisa Chu, and I'm one of the academic chiefs. I grew up in New Jersey, went to LeComm Bradenton for medical school, and ultimately came back here for my residency training. One of my favorite things about the program is the one-to-one teaching our program provides. From day one, you're paired with one attending on your service. And this really allows for undivided attention between the attending and the resident, as well as an excess of hands-on procedures. For example, as a PGY3, we have 3 months of spasticity, where we do hundreds of Botox injections and baclofen pump refills. And that's really not an exaggeration. We do quite a lot of procedures in our program. The only exception to the one-to-one teaching is during our EMG rotation, where we double up as a PGY3 and a PGY4. And this really allows the unique opportunity for a senior resident to help teach their junior resident while enhancing our EMG skills. Another unique feature about our program is our monthly hands-on ultrasound curriculum that focuses on one joint per month, and it cycles every month. We spend 2 hours learning to be comfortable with the probe, recognizing the anatomy, and learning how to perform different types of injections with our sports medicine attending. And so I would say our one-to-one teaching and our hands-on experience is really invaluable with our program. I'll pass the mic along to Roy.
And sorry, speakers, 5 more minutes.
Hi, everyone. I'll try to keep this short. I'm also from New Jersey. I went to New Jersey Medical School for my education, and I'm interested in sports spine. I'm one of the academic chiefs as well. One of the things that I like about JFK, and there's a ton, are the perks. You know, as a resident, we all know that, like, you know, it can be costly, you know, through our education. Some of the perks that JFK offers, it's a $200 a year a book fund we can use on any kind of reading material that would enhance our education. We also get free lunches. Our conferences are completely like paid for. We can make a little bit of extra money in admissions during the weekends. Wellness events are sponsored events by you know, the program, so it's free for us as well. Any kind of away rotations that we have are completely reimbursed as far as the commuter, like the commute and lunches. And I can keep going on, but since we are limited on time, I'd like to just leave it open for any kind of questions that you guys may have for us.
So feel free to type any questions that you have into the chat, and then we'll go ahead and answer those as they come in. Okay, so the first question, what do you like to do for fun? So I think what's great about JFK is that we're right in Edison, New Jersey, and so we're about an hour and a half from New York City, and then about an hour and a half away from Philly as well. So I like to actually go to both in my free time, which is really great. But other than that, I'm a big sports fan. I like to watch sports, play basketball, that kind of thing.
I can answer the question about the OMT, David.
Yeah, sure, go ahead.
Yeah, so somebody asked, are opportunities available for residents who want to utilize OMT? So I am a fellow DO. We do have some attendings who are DOs that will incorporate a little bit more into the MSK training. We do have a sports doc, Dr. Brown, that will see some patients induce different manipulations. And we actually had a resident, I think about 2 or 3 years back, that was very interested in OMT and incorporating that into his private practice upon graduation. And so there are ways to seek that and help you know, enhance that learning during your 3 years here with us. And I don't think anybody has ever, you know, felt pressured to kind of continue that training should they not want to, but it is an available opportunity for you.
Sorry, speakers, 2 more minutes.
So I think the next question was, as an advanced program, is there any help given to match for the PGY 1 year? So we don't have a built-in like PGY 1 year. And so for the most part, a lot of our residents, they've done preliminary medicine years, prelim surgery years, and transitional years. And so we have residents here that had like a diversity of experience for their PGY 1 year. Can you describe the patient population that you serve? Do you feel like you get a diverse experience? Yeah, definitely. Roy, would you like to speak on that?
Absolutely. So one of the things that JFK offers is that we actually have quite a diverse population in the area. You know, I myself being Hispanic, I actually, my Spanish, my language, I guess skills come in handy when it comes to translating, you know, trying to connect with patients on that level. So we get the whole gamut of the patient diversity, if you will. In the event that, you know, there's a language we don't speak, we also have translators. So, and we use it quite often. So if that gives you any indication as to, you know, how diverse we are, like it gets, like I said, pretty diverse, because we get patients from all types of facilities all over New Jersey, and sometimes, you know, out of state. So again, we get people from all over the place.
So the next question, is there a timeline on when the sports and spine fellowships will be accredited? I think that's just, I guess, looks like more like a general question in terms of rehab. I don't personally know about that, unfortunately. And then, let's see, does your residency program work with any community service programs? Well, I will say that one of the things that you can do as a resident is you can volunteer your time at football games and be the sports medicine physician there. In New Jersey, you have to have a physician on the sidelines for high school games. And so we cover 2 high school teams here in Edison, New Jersey, and we cover all their home games. And we also get compensated for that. So that's one of the community service, I guess, community sort of programs that we have.
Sorry, time's up.
Okay.
Yeah, so thank you so much for everybody from JFK for your time. And for the rest of the audience, if you have any questions or concerns, please direct it to the program's contact person.